So the title of this presentation is Immersive Simulation that Tackles Public Health Crisis. So I'm going to give you guys some numbers that you may want to use and take back with you to your institution or your organization. Did you guys know that 90% of students state improved retention when they use an immersive solution like virtual reality? 80% of students, they looked for VR courses when they were signing up for school because that school wasn't a millennial Gen Z destination yet. New hires, they're seeing a 40% decrease in intern time. What does that mean? It means that we currently have evidence of new hire students. When they complete their clinical education, they're getting hired, and rather than being tied to a proctor for 9 weeks, it's down to 5 weeks, and they're doing solo patient care, provider care. That is a huge deal. It's a big deal for the school because now the new hire organizations want more students from them, and it's a big deal for the organization because they don't need to tie a professional healthcare provider to an intern for too long. 45% of students practiced more when they had VR because they felt comfortable, and virtual reality levels the playing field. I get nervous when I'm on stage and I have to tell everyone how to run a mega code for my ACLS 3 cert. It's scary. 65% of students prefer labs in VR by themselves because they're not afraid to fail by themselves in a lab. And 90% of students, they want VR learning at home. They want to be able to practice their clinical competency in the comfort of their own home. So now let's talk some other numbers. We all know who the World Health Organization is. Did you know that they have predicted a shortfall of healthcare workers that is you? By 15 million, we're going to be short in 7 years by 2030. I want everyone to take a moment. In 7 years, we're going to be short 15 million healthcare workers. 13 million of them are predicted to be nurses alone. That means we need to produce 2 million more nurses per year, every year, starting yesterday, just to meet the need. How are we going to do that? When I go to the hospital in 7 years, I want there to be the nurse. We have to scale together. We have to use solutions that don't always require a one-to-one relationship with the instructor or the clinical educator and the student. We have to empower them to begin their clinical education outside of the classroom so when they come in, they have seen 300 patients before they ask their question to you in an iterative environment that allows them to fail often and fail fast at home. And you get really good, deep questions in the classroom. Let's talk about hospital strain. The number one problem, the number one concern of hospital CEOs across the country, personnel shortages, including physicians. That's higher than the budget. That's higher than, we don't make enough money. It's the people. They need more of you. They need more of the professionals that you are creating. So in 2020, the nursing shortage rose to 1.1 million. Remember, we were talking about 15 million in 7 years. And it rose to 1.1 million, and central line infections went up by 28%. Now, there's a lot of immersive solutions out there trying to go, we're going to tackle that problem by creating a virtual reality solution that teaches doctors how to do central lines better so they don't have infections. And that would be the wrong solution because this metric is not associated with the physicians and the central line insertion. It's associated with the care team after the central line is inserted. What's that number going to be when we have 15 million short? Are you going to want to go in the hospital and get care? Today, in 2 years, we're looking at over 500,000 shortage of health aides, assistants, nurses in 2 years. Meanwhile, the community is aging out 65 plus at an extremely high rate. It's expected to rise from 54 million to 80 million people 65 plus in the next 17 years. That sounds like a long ways away. My kids are going to be entering the workforce during that time. What are they walking into? 17 years? It's not very long at all. Hospitals need people faster, and they need to be competent. It can't just be your run-of-the-mill nurse who gets put in a lower level acuity unit because they're just not quite competent or ready yet. They need to be competent on day one. We want our new hire nurses to be as competent as a one-year nurse. Can we do it? Can we get there? You guys are the solution. It's the clinical educators that are the solution to this problem. The hospitals cannot hire more of nothing because we have to produce them. Let's talk about emotional exhaustion. I'm a healthcare worker. I worked in the hospital. I'm a medic of 8 years, but I was a hospital medic. I work alongside nurses every single day. There's an EE quotient, the percentage of emotional exhaustion. It's up 28%. It's up 27% in 2 years. So how do we combat emotional exhaustion? Well, right now, if I'm in the hospital and I get a patient who really messes with me and I'm emotionally damaged by that. My patient that I'll never forget was a 3-year-old drowning. Couldn't save her. I really needed a critical stress debrief. But what's available to me today? I go talk to my nurse charge, who then sits me down. Okay, she says, wow, you're really messed up in the head. Let's go talk to HR and get you situated. And maybe they assign me a healthcare professional for my brain, and I sit down and I talk to that person, and they go, you need a day off. And I don't take that day off. Because if I take that day off, then all of my nurses don't have the best medic in the emergency department to put in your lines for you and to run your meds. And you guys were there, right next to me, with that same patient. Why aren't you taking a day off? And if we all took that day off, who's the patient have at the bedside? This isn't a scalable solution. I'm not saying mental health for the healthcare provider, I'm not saying don't talk to a clinician, do it. But there must be more ways. And I believe that if we can provide nurses and healthcare workers with a solution that meets them where they are, I know why I got into this business. I wanted to heal people. I wanted to help people. So give me the chance to try again. Have you ever heard read it, write it, teach it? What if I had the opportunity to try on that 3-year-old drowning again? For me to iterate and to learn, I did everything I could. And that actually was a no-win situation, and that's not going to change. Because I know if I stay in this profession, that patient's coming back. Maybe they're going to be 4 next time. I'm not leaving the field. I know why I'm here. Give me the chance to try again. This is where immersive solutions can really help out. What if I could put on a headset? What if I could build that patient in virtual reality, try it, and then deploy it to my staff, and then I will teach you on this halo, high acuity, low occurrence patient that came in. They're coming back. So let's learn together. That is catharsis for my mental health, because I know I did a good job, and I'm going to do a better job when they come back. And who knows? Maybe I'll play some Beat Saber too and relax in the break room and go visit the Alps and really unwind and leave without leaving. Now, the American Hospital Association put out some numbers on 5 ways to ease the staffing shortage now and into the future. And I highlighted just a few things, and I just want you to step back and look at them. Customize, advanced practice, millennial Gen Z destination, integrate, and create your own solutions. The solution is not to do the same thing over and over and expect a different result. It's to create something that makes you Nurse Educator 2.0. It's not to replace you. We need to give you a bigger tool to produce more. And wouldn't it be nice if we were all a millennial Gen Z destination and our students really, really wanted to go to your school? We need 2 million more a year anyways, right? We need to attract them. So what I'm showing you here is the world's first programmable virtual reality smart pump. It's created by VR Patients. And this is an opportunity for a clinical educator or a professional to really program a smart pump without having the physical smart pump there. That's not to replace the need or the use of smart pumps. They've saved countless lives. But what if your school or institution doesn't have smart pumps? And they're going to get a job somewhere that does. They're supposed to be competent on day one. This needs to feel real and be real. And it needs to be programmable by you, the subject matter expert, because you know how this fits into your curriculum. You know your curriculum. Who am I to tell you what your curriculum should be? It's my job to provide you with a solution that solves the problem that you are telling me. I have this problem. Great. Let's get to a solution together. The reason why we develop this way is to be as accurate as possible. As you can see over here, it's like a 3D model rendering of a central line port, because you can hang up to 10 bags, 10 infusions that drain in real time. So the scenario can start and there's only 5 minutes left in the infusion. And you can actually see there's only 50 mLs left in the bag. What do you do now? What are your doctor's orders? Check the MAR. Initiate treatment. Move your student onto the next level. Then they go into the next scenario, and it's the beginning of the smart pump, and there's multiple bags. Maybe it's critical care. Maybe it's a nurse practitioner and they're recertifying. We try to make it as realistic as possible. So the fluids drain in real time. We spoke to the manufacturers and got their algorithms. Our poor developers are having to learn the math of a drip rate, a drip set, the gauge of the IV, how many drips that's going to be, and what the pump's going to do. And then daisy chaining. But we're good at that. We're doing the math for you so you can have the solution to put this together like you do in real life, but deploy it to 10 students or 10,000 students. It does not matter. What about social determinants of health? Why would a nurse need to start a scenario out in a bedroom? Well, our social determinants of health are everything about our society, our life, where we live, where we work, what we eat, who we hang out with. We need to give our nurses the opportunity to see those clues and feel like you're actually there for a moment. Because you know how heavy of a lift it is to build that simulation in real life and get all of your standardized patients and go outside and cycle people through that? So what if your student could start somewhere and then end up in that clinical setting, or go right into that clinical setting and start treatment? The purpose of that first environment is to include some social determinants of health. Then move on into the clinical setting and start treating to make sure that it's diverse. It's a community-based experience digitally. And I'm not saying replace your in-person simulations. I'm saying add to them. Make them 2.0. Have them come to the in-person day with more questions than you've ever thought of before, and really, really good questions. You got to reflect diversity. Your solution has to reflect diversity. I live and was born and raised in Tucson, Arizona. I'm about an hour from the Mexican border. You have to include in my education that community. You have to include diabetes. I need to see people of different shapes and sizes and different colors. I need to have a patient speak to me in Spanish, because that's what I'm going to get when I enter the workforce. So what if you had a tool that would allow you to build that would speak in whatever language you could type in? Heck, use ChatGPT to translate whatever you want into any language you want. And what if that avatar could speak to you and really challenge your student? Where's your pain? No sé. Well, crap. Now what do I do? Call the doctor. So I even asked ChatGPT, what's the answer to this solution? I told it, here's what the WHO says. What's the solution? The number one solution that it says, and I was specific, which solution would make the most impact today, positively? And it is expand and enhance education and training. And number two is technology. We have to combine those two. You are the number one solution to the World Health Organization's problem, which is all of our problem. It's not me. It's not anyone at these booths. It's you. We have to empower you with the tool. So what else can an immersive solution do for you? Isn't it a pain in the butt to report to your accrediting bodies? You have an auditor comes to you and they say, you gave a license to someone. Her name was Julie. I want to know what simulation you put her through January 21st when she went through her third year. And today you go through a filing cabinet, you pull out a piece of paper that was signed by someone who no longer works there. And you're like, fingers crossed they filled this one out. Well, what if today you could just do a simple word search? G-U-L, oh, there's Julie. And you click on her, and the auditor's standing right next to you. And you can see every single clinical simulation that she did that she got actual accredited hours for. and you pick one. And you go, here, she did a cardiac patient on this day at 6:15, and you click on it. And I can see every single critical action she did or did not take. I can see her score. I can see the timeline of every action she took. And when she administered a medication, I can see the vitals of the patient in that moment. I can also see how long she spent in the sim, that she didn't rewind, and that she achieved competency, because you cannot get the successful grade if you do not complete the objective action. And then you turn the credit to the auditor and you say, would you like that in a PDF or a CSV? Also, would you like to try the patient, because I can load it for you? That is a whole different world. And that doesn't take any time at all for you. You don't need that filing cabinet. If you want to print them, you can print them. That's the tool that you need. The answer is you to the rescue. This first picture right here, that's me 2.0. So I'm an educator. I teach, albeit paramedics, but I teach them. This photo right here, we put 40 professional paramedics through continuing education clinical simulations. 40 of them went through 4 trauma scenarios. And we issued over 120 continued hours of education in 2 days with one instructor. And that instructor built those scenarios by himself. And he's not an engineer. He's a clinical professional, a clinical provider. I was there to support him. I helped him charge his batteries. I asked him, how did you do this? And I work for the solution. Because our customers are doing things with the tool that we didn't anticipate. Because that's what you should do. You should be creative with the tool. Bend it to your needs. Want to be medically advanced? Make sure you can train the nurse practitioner. Make sure it's engaging. This guy right here, this is a great story. This guy actually was a customer of VR. He still is. He's a customer of VR patients. He was a customer for 2 years and used the platform on the laptop only, because we're available on the web, laptop version, or the virtual reality headset. He came to our booth and was telling us how much he enjoyed it and how he's using it. And everything he described was on the computer. And we said, have you never done this immersively in VR? And he said, no. Do you want to try it? And he put on the goggles, and his mind melted. Then he went back to his hotel, and he ordered a next day Air Meta headset delivered to his hotel. He brought it in the cellophane to our booth the next day and asked us to help him set it up. And he took that back to his institution and said, this is what we need. This is what we've been missing out on. Because there's a fear of adoption of this new technology. And that's him on the floor looking underneath the feet of the avatar to look at blue deoxygenated skin and palpating the pedal pulse, because he'd never seen under the foot and always wanted to know, did you guys do art there? Yep, we sure did. All right, really quick, guys, I want this. We're partnering with an ASCO right now. This does not require your name or your email. Everyone here at the conference, if you could just take a peek at the stage, the screen, there's a QR code on the screen. Please scan it. Don't just take a picture of it, scan it. And click on the link. It's a survey. It is 2 questions. What is your role or your title? And what is your biggest challenge in clinical education? We don't need to know who you are, but we cannot work together to solve these problems if we don't hear your voice on what challenges you're facing. We will be providing these results to an Axel so they can operationalize them and use them as well. Don't hold back. We made the form field as big as you would like it, so write them an essay or give them 2 words. I've explained a very high price to this. And I'm not talking about price of an immersive solution or a product. But there's a difference between price and cost. And what is the cost of us doing nothing or not collaborating on immersive solutions to solve big problems? We can get a window into what the world's going to look like with 15 million people short to treat our community. We need a solution that does not force educators to increase tuition on their students, which they need to double and triple in their graduation rates. We need a solution that is scalable in technology, that you can bend, and is scalable in price, so we can meet the need and not pay the heavy cost of doing nothing.